idea of offering MIGS uncoupled from cataract surgery is a recent innovation in the surgical management of glaucoma. Standalone MIGS has the potential to significantly expand the number and kinds of patients who can benefit from procedural options. As surgeons across the United States consider whether to offer standalone MIGS, Sight Sciences has engaged with early adopters to understand the process they went through during implementation. Has it been difficult to identify patients for standalone MIGS?
As an anterior segment surgeon, traditionally, we were always doing MIGS around the time of cataract surgery. That's the way it was launched years ago. Now, as we identify these patients much earlier, and there are issues of polypharmacy, compliance, and ocular surface issues, we're using that technology and now applying it in a freestanding way, in a standalone way. We have other ophthalmologists in the practice as well as optometrists that refer patients to me, since I really enjoy doing MIGS, both during the time of cataract surgery, but now certainly in patients that are standalone.
So hearing about standalone MIGS has been a really exciting, I hesitate to use the word breakthrough because we've had MIGS and we are using MIGS. But as a concept, I think it has allowed us to identify patients at earlier in the spectrum of disease and during the disease and even later in the disease, in that we can treat patients at the time of surgery, post-surgery, before they need cataract surgery. It really opens up the spectrum on where we can offer intervention. Now with standalone, we have this new arm of treatment where we can say, look, we know you're not ready for cataract surgery, but because you're struggling with other parts of the disease process, we now have another option that we can present to you, and we can maybe work to get things under better control.
Who would benefit from standalone MIGS?
I would say that standalone MIGS is a viable option for a variety of glaucoma patients. I would say that the ideal patients for standalone MIGS would be patients who are young, they don't have developed cataracts, we've tried other treatment options, and they're not ready for cataract surgery. They would be eligible for getting standalone MIGS. Patients who are already in their 60s, 70s who had cataract surgery, they would also be eligible for this procedure. Patients where compliance is an issue, they have arthritis, they're not able to get drops in. Patients who have ocular surface toxicity. I think there's a variety of different cases where a standalone MIGS would be a viable option.